This video is going to show you a couple structures within the neck region of the fetal pig, as well as some of the thoracic cavity structures. So if we work our way from the anterior of the pig towards the posterior, you will notice that this large swollen structure right here is actually the larynx. The larynx is essentially our voice box. This is where our sound is generated. As air goes from the nasal cavity or the oral pharynx region, it goes into the larynx, down into the trachea, and the trachea will branch into the lungs, which I'll show you after we look at the structures that are surrounding the trachea. So the granular tissue you're seeing to the left and the right of the fetal pig is actually the thymus gland. The thymus gland extends down and actually covers the anterior portion of the heart. And this particular portion we're going to remove when we go to look at the heart more closely. And the thymus gland is really enlarged in the fetal pig, but as this pig matures, it will reduce in size. And this structure is very important in the immune system of mammals. Now, you can also see that there is this smaller structure that is actually wrapped around by the thymus gland. When you pull the thymus gland back, it reveals this structure. This is the thyroid gland. The thyroid gland is responsible for our metabolism regulation, and it's part of our endocrine system. Before I keep dissecting to separate the lungs, so that way we can take a better look at the vascular system as well as our respiratory system, I wanted to show you that there is connective tissue that holds the lungs and heart in position, and it attaches to the diaphragm, which I'm holding with my thumb. And what it does is when the diaphragm contracts, it causes our rib cage and our thoracic cavity to expand. And when it does that, it creates less pressure inside the thoracic cavity than the outside air. So it's what forces air into our lungs. And this is something called negative pressure breathing, where you're actually going from more pressure to less pressure. And that's what drives the movement of the gases. If you look at this region here, we are actually focusing on the thoracic cavity, and I've trimmed the ribs away so you can see the lung and the heart. And I wanted to show you that as the trachea comes down, it runs behind some major blood vessels. And if we open the lung up a little bit, we lift up the heart, you can actually see the pulmonary arteries that are taking the blood towards the lungs, and the blue veins you're seeing here are the pulmonary veins, which are returning blood back to the left side of the heart because that's where it's going to go after it picks up some oxygen to be delivered to the rest of the body. Now you can see the ribbed structure here still. This is the trachea. And as the trachea comes down, it starts to branch into the structure called bronchi, and the bronchi will branch into the left and the right lungs. And you can see that there's actually still a ribbed structure here that's going towards the right lung. And this is one of the bronchioles that starts to separate and branch out to allow the lungs to have as much gas exchange as possible.